Hi, my name is Dr. Justin Dorenzo. I'm a forensic and clinical psychologist, and I'm going to tell you a little bit about my career path for your class today. First of all, this is my name. This is how these initials designate that I have a doctorate in psychology, and that I'm board certified by the American Board of Professional Psychology, and that's actually in clinical psychology. So in addition to practicing forensic and clinical psychology, I also spend a great deal of my time doing couples therapy. So because one of the subfields that I'm in with forensic psychology is doing a lot of family law type of work. So work with lots of families, lots of divorced people, and doing custody evaluations and things of that nature. So instead of helping people on the end after they're deciding to separate, I also try to help save marriages as well. So I want to tell you a little bit about my career path, and then I'll get into more about the field of forensic psychology. So I started my educational career at Furman University in Greenville, South Carolina. I spent 2 years there. I really wasn't that motivated for school, wasn't ready yet. Actually spent some time doing construction for a couple of years. And then decided to go back to school. And I was living in Jacksonville at the time, so I attended UNF and graduated there in the summer of '97. And then I found myself working at Gateway Community Services because I had majored in psychology, and I was considering being a psychologist one day. So I wanted to get some experience to help get into a graduate school. So I worked at Gateway Community Services as an addictions counselor for 2 years. And I was applying to several schools, and one of the schools that I was accepted to was Nova Southeastern University in Fort Lauderdale, which I highly recommend to anybody looking at getting a doctorate, a PhD, or a PsyD in psychology. And I was at Nova for 4 years, earned my master's, and in psychology, one does not get their doctorate until a year after those 4 years of graduate school, after an internship is completed the 5th year. So I spent 4 years at Nova. While at Nova, I worked at the Miami VA as a practicum student, and then I also worked for a program called Guided Self-Change, which was an addictions program. Following my time at Nova, I actually ended up getting a commission into the Navy, into the Navy's internship program as a budding psychologist. So I couldn't classify myself as a psychologist yet, but as a psychology intern. And I went to Portsmouth Naval Medical Center there and spent a year there. And then at that point I had graduated, and then I spent some time in Pensacola, Florida, Guantanamo Bay, Cuba, and then I spent 2 years on an aircraft carrier. And while in the Navy is really when I got involved in a lot of forensic type of psychology, where you're typically working, your job is to take care of people's health care, but it's also in managing problematic sailors and their family members, and you're working with the legal system a great deal, the JAG officers in the military. So you're helping commands make a lot of decisions about whether people are fit to stay in the service, how responsible they are for certain things that they may have committed. And then after the Navy, or while at the end of my Navy tenure, I earned my board certification in clinical psychology. And then I decided to get out of the Navy. My wife kept getting pregnant every time I would come home from deployment, so we decided to get out of the Navy, and I always had a dream about being in private practice. Anyway, so got out of the Navy. I worked at Brooks Rehabilitation Center here in Jacksonville for a few months as I was trying to start a private practice, which I was moonlighting in the evening and doing, and then after 3 months I decided it was time to go. So again, I started my private practice, and my private practice was all based on clinical and forensic psychology in the beginning. And in terms of some of the training that I've had while in private practice, some of the more formal training, the first thing was family mediation, where I became a Supreme Court family mediator because I found myself doing a lot of things with the family law community. And when you become a mediator, it's You can help people actually do divorces like a lawyer can. You can write up a divorce agreement and come up with a parenting plan. But I had to have that to become a parenting coordinator. And parenting coordination is when the judge is sick and tired of seeing two divorced people that no longer follow the parenting plan. So he has someone like me, and it's a psychologist, another mental health person, or a lawyer that helps them manage their divorce, their post-divorce life with their kids, and helps them resolve conflict. And then I've also had I'm a qualified forensic examiner, also in the state of Florida, and that allows me to determine whether somebody is competent to stand trial, or if they were responsible for committing a crime. But I do not do a lot of that. I don't do a lot of competency work. So I do work some in the criminal system, but it's more as a mitigation specialist. And what that means is, if somebody commits a crime, a mitigator helps them. You do a full psychological analysis of the person, and you look for different psychological vulnerabilities that the person may have had that may have led to the crime. And there is a formula in the state of Florida, and if you score a certain number, then your sentence gets reduced. So that's something that defense lawyers will hire me to do, to help them with their clients. All right, I'm going to sit down, and I'm going to answer some more of these questions more specifically. So my camera woman can sit down if she's so inclined. She's okay. All right. So I explained about what my path of my professional career. Again, the subfields are clinical, and this is like the actual treatment of people with psychological disorders. I focus on anxiety, depression, teenagers that have issues, and then also a great deal of the clinical part of my practice is dealing with couples that have relationship issues, dealing with fidelity, infidelity, pornography addiction, and things like that. But that's about 50% of my practice, and then the other 50% is forensic type work. And forensic work that I'm typically involved in are social investigations, which are custody evaluations, and these are people that are they're getting divorced and they're fighting over who's the better fit to be a parent, and what kind of parenting plan the parent should have with their children. In addition, I do parenting coordination, which I talked a little bit about, and I also do, as a psychologist, I do evaluations for personal injury attorneys as well, and typically, so I'm evaluating. I work for insurance companies, the insurance company attorneys, but also for the actual. With the insurance companies, there's often it really depends upon the case, but sometimes you're working for the person that was injured, and you're working for their attorney, and then you can also work for the insurance company as well. Proving that the person doesn't have such severe injuries that they say they have, and the injuries that I'd be evaluating would be emotional, psychological, like PTSD often, and a lot of accidents, things of that nature. And let's see. So, can you describe what your interactions with clients are like? I probably spend about half my day interacting with clients or patients, whether I'm doing evaluations or whether I'm treating them for some psychological problems. The other half of my time would be reviewing legal documents, doing collateral interviews for a case to try to figure out if people are telling the truth or not. I'm also writing very lengthy reports because the court and attorneys like very long reports that provide lots of information, lots of helpful information. Can you describe what interactions with clients are like? Interactions are typically in an interview room, such as this one, and most people that come to see me are they're hiring me to work with them to help them resolve a problem, or find out the level of their injury, or help them decide on what the best parenting plan is for their children, or whether they were culpable for for some crime that they committed. So people are typically cooperative with me because I am typically trying to help them, and I'm their advocate. But on the other hand, sometimes if I'm working for an insurance company as part of a personal injury case, they may not be so helpful with me because they know that I am possibly going to determine that they're not as injured as they say they are, emotionally injured as they say they are. What do you like best about what you do? I like best about what I do is just having my own practice and not having a boss, and being able to have autonomy and really spend the day how I want to spend the day and be able to choose the clientele that I work with. So, when you're in private practice and when things are running smoothly and you've established a reputation, then at some point you don't have to take every case. So you can actually pick the more interesting cases and the cases that you feel that you can offer something. What is the most difficult part of what you do? I have to tell you, dealing with divorce and people that, in a custody evaluation or social investigation, you often have two people that are exaggerating their, all the benefits that they offer and deny any bad things that they have done. So you're often the investigator, and it's often during it's often, you're in the middle of lots of acrimony with two people that are not being truthful. So it can be very challenging, and then when you're making a decision or making a recommendation for the courts, it can be very stressful because you're always hoping that you made the right choice, made the right decision, because there's always more information out there that you may have not looked at. And what advice would you give to students looking towards working in your field? I would say that being a psychologist is a very unique position, and the field of psychology certainly has its challenges. We don't have we're not very strong politically, so you have to know that you are up against a great system of other types of professionals that may not always recognize the importance of psychologists. So you can't ride on the coattails of being a psychologist, even though when you're in school, there's so much focus on the degree and the power possibly that it may hold. But in reality, a lot of your success will depend upon you rather than the degree that you hold. So you have to be ready to work really hard. Are there any qualities that you have found to be the most helpful in your professional career? I would say you've got to, if you're an introvert, you've got to learn to be more extroverted. If you're building a practice or you're interacting with people, you've got to be able to be an extrovert, especially if you're going to be a forensic psychologist, because you're dealing with the court system. You're constantly I testify probably 3 or 4 times a month. Well, a high month, but often it's at least 2 times a month. So you've got to be able to deal with scrutiny and being up on the stand and having somebody tear you apart and look for all your weaknesses, and somebody that attacks you personally and tries to destroy your credibility. You have to have thick skin and you should be sensitive with your clients, but when you're working with the court system, you can't always be so sensitive. And then, are there other professional paths you could have taken given the coursework that you completed? I am very happy that I became a psychologist. I probably would have not have chosen another career field. Of course, I joke with my wife that I would be a dentist if I would do it all over again, because they seem to work the least and make the most. But if your heart's set on psychology, I would certainly, psychology is an awesome field. But I see a lot of dentists in therapy, though, I have to tell you, and they often complain about their necks and their backs hurting because they're bent over patients all the time, and they're constantly complaining, even though I know, when they're seeing me, it's usually on a Friday and they're already off of work, and I'm working, seeing them. And they're complaining to me about, how hard their life is. All right, and then the last thing, is there anything else you'd like to tell students interested in a career as a forensic psychologist? I would say just, try to take as much coursework in forensic psychology as you can. When I was in graduate school, there was a track of forensic psychology. I did not focus on forensic psychology in graduate school. It was mainly clinical psychology. It was not until I was in the Navy where there was training in forensic psychology, and also since getting out of the Navy and doing a lot of training on my own. But I would say it's important to learn, as a psychologist, it's important to learn about every subject in school, because you have to learn how to relate to all types of people, from people from very low socioeconomic status to people that are very high, and you've got to be able to connect with them. So it's important to know about all types of cultures and all types of things. So. But anyway, thank you very much for allowing me to do this. My assistant, can you think of anything that I have forgotten?